Hi, it's January 8th, 2021. It's Dr. Ann Zink providing a brief update with where we're at with COVID-19 in the state of Alaska. You can see in general our cases have continued to trend down. However, we're starting to see, unfortunately, a bit of a plateau, and in some areas we're starting to see an uptake in cases. Currently, we have about 36 cases per 100,000, and we continue to see this kind of halving. We continue to see the percent positivity climbing up slowly, and it's just a good reminder that we really need to make sure we're doing all we can to slow the spread of this virus so we don't hit another spike. A couple things about that. We are looking for this UK variant, a variant of the COVID-19 virus, the SARS-CoV-2, that looks like it spreads more quickly from person to person. At this time, we have not found it in the state of Alaska, but we continue to look. And every day that we can slow the spread and keep it out of our state gives us more time to vaccinate, gives us more time to protect each other, and really helps to move Alaska forward as quickly as possible. So we ask anyone who's traveling to make sure they get tested 1 to 3 days prior to travel, staying home for 7 days after travel, and getting a second test after travel. Doing both of those things will help us slow the spread and importation of this mutation that we have seen in other states. Speaking of vaccines, there's a lot of work that's happening on vaccines right now. We are in the stage of very limited availability, and we're getting it out as quickly as possible. Our goal is to get it in arms as soon as we have it and as soon as we possibly can. To do that, we've worked through a series of tiers and a series of steps that I just want to take a bit to go through. Right now, phase 1A is fully open. So this includes everyone in long-term care residencies, facilities, hospital-based frontline workers, EMS, fire services, community health aides, and those who are providing vaccination, as well as healthcare workers who meet all of the following. They have direct human contact, they can't do telemedicine or postpone their work at all, and they can be working in a clinic, a home, or a hospital, and it can be community-based. So if you meet all three of those criteria, you fit within this tier 3 of phase 1A and are available for vaccination. We did open phase 1B tier 1 over the week as well, and this is those who are 65 and older. This is a big group, and it's been a challenging week, and it hasn't gone as smoothly as we would have hoped. And for every one of you who have spent time and effort trying to get vaccinated this week and haven't been able to, I'm sorry. Continue to try to improve the process as quickly as we possibly can. I'm excited that we're still one of the most vaccinated states in the country. We continue to get vaccines out quickly. We see huge interest in this age group. We continue to work with all of our partners to get vaccine across the state. And as soon as we get more vaccine in, we continue to open up more clinics, more availabilities, and continue to bring on providers on a regular basis. Once most people in this group have been able to get vaccinated, we'll move on to tier 2, tier 3, and so forth. But we'll give enough time to be able to get tier 1 in. I think of it a lot like boarding a plane. There are a lot of people who want to get on. We're building a lot more planes to get people off, and communities are doing tremendous work setting up things like mass vaccination clinics to be able to vaccinate more people. And as we call each tier through, you still have the ability, even if you missed it, to go if your tier has been already called. And we just can't all get on the plane at once. We can't all get vaccinated at once, but we'll get there. And so we just ask for patience as we're all trying to figure out this process together. We'll continue to improve our system. And again, I apologize for a lot of frustrations that happened over the weekend, but I am super grateful to see a lot of people getting vaccinated right now as well. So there's a couple things that I just wanted to go over that I wish everyone knew about the vaccine and vaccine process. Our goal is to get vaccine out as quickly and efficiently as humanly possible. We do have a website, covidvax.alaska.gov, and this allows you to see what people in your community are offering public sites for vaccine. It may not be all sites, so there may be clinics or other people who are doing what we call closed pods. So they're doing it particularly for like their patients and getting small amounts to go through. Again, we need lots of planes to get this process off the ground as quickly as possible. And the ones that you see on the COVIDVax contain all the publicly open ones at this time. You can also see an additional website called PrepMod, and this one takes you to a separate website called myhealth.alaska.gov. This is a scheduling software that some of the communities and some of the clinics have opted to use to be able to schedule their vaccine, but it doesn't include everybody who's on the list who's offering vaccine. So we've seen that email sent out around a lot. And again, it's a chance to see some of the clinics that are out there, but not all of them. So if you want to look at all of them, you need to go to the main website. Again, just like our testing map, it gives you a sense of what's happening in your community, but we don't run all of those different scheduling appointments. Many of the pharmacies, primary care clinics, others have their own scheduling software that they use. Our system is just a way for you to connect to what's out there. You may start making an appointment, but again, that's within each individual community and each individual site. So, Fred Meyer's or Bernie's Pharmacy or the PrepMod site may all have different ways that they manage the wait list or additional information back. That's been confusing to many. Again, I just want to remind people this is a private-public partnership, and we're just connecting you to the private centers that are there. And then many communities are setting up additional vaccine sites as well. More vaccine and more appointments come out daily. So we continue to update the website on a regular basis as soon as any clinic or any provider has more availability and space. And we're looking for each community to make sure there are enough providers to get as much vaccine out as possible. And if a community doesn't have enough providers, we work with that community to say, how can we improve this? And it might be at pharmacies, it might be the fact that we need more mobile clinics, it might be these big kind of mass vaccine clinics that happen. And again, it looks really different across the state depending on what community that you're in. Again, if you miss an opportunity to get your vaccine because your tier was called and the sites are full, or maybe we've moved on to another tier, you haven't missed your opportunity. That continues to be an option for you. So again, if you're in phase 1A, tier 3, you are open for vaccination at this time, even though we're starting to work through those 65 and older. Once there are open appointments on a regular basis, once we see most of that demand in the first tier or the next tier that we're at that's open, we're going to move on to the next tier. So we don't have a commitment on when we're going to move on to the next tier because we don't totally know what the uptake is going to be for that group 65 and older. So we're going to wait till most of that capacity is out till we have enough extra vaccine in the state. But we're not going to wait until we have everything for that next tier to be set and ready because we don't want to let vaccines sitting in the freezer and we don't want to have appointments go unwasted. We're trying to balance making this perfect system to have everything there with not letting vaccine wait and continuing to move forward as quickly as possible. Again, think of it like boarding a plane. We'll keep calling up the next tier once most of the line from the last one has gotten through, but you still may need to wait for a bit until more sites and more availability comes open. We are here to help, and so is many of your community partners. We do have a call line that can schedule the appointment for you. So if you're over 65 and you're having a hard time with the system, we get it. It's hard. It's not super simple. But feel free to give our number a call, and that's 907-646-3322. Again, that number is 646-3322. You do have to leave a message, but we call you back. Our team worked actually late into the night last night calling people back once another site was open to get people scheduled as quickly as possible. So if we see something in your community that's opening up quickly, we will help you kind of get through that process. So feel free to give that number a call. If you are in one of those tiers regularly needing to be vaccinated, again, 65 and older or healthcare workers, and if you aren't able to do it online, we can help you. There may not be appointments available, but we're happy to work with you through that process. We also encourage you to check base with your local public health leaders, as well as your public health offices and emergency operation centers, because you have a good sense of what's happening locally as well. We are also finishing our recommendations for phase 1C, and this is kind of the next group of people. We do have public comment opening January 11th, and we really encourage the public to take a look at the process, take a look at how we're trying to decide kind of which tier is up next. Again, we don't want these tiers so big that everyone kind of rushes into the system. We are big enough to keep doing vaccination as quickly as possible. Has nothing to do with importance. Again, we're just really trying to balance the science, decreasing the morbidity and mortality, keeping systems open, making sure healthcare and other things don't become overwhelmed, making sure it's logistically feasible, as well as making sure that people have a chance for equal outcomes regardless of where they are and really getting that equitable distribution. We'd love to have your input. It really helps us a lot. And again, January 11th, you can sign up ahead of time to provide oral testimony, and you're always welcome to provide written testimony as well. Vaccines, like I've described before, are kind of like the sun. Right now, we have a little bit of sun, and we know that more is coming. And the same is true with vaccine. We've got a little bit of vaccine in the state, but more is coming, and we'll continue to get it out as quickly as possible. And I think that each month it's going to get better. The system's going to get better. We're a couple weeks into this process. We found out our allocation numbers for January a few days before January. So we are working on very tight timelines. Again, the goal is to get it out as quickly as possible. But in the meantime, we have lots of other ways to slow this virus, and we need to continue to slow it, particularly as we see numbers starting to climb, particularly on our road system. We need to slow it down, again, by keeping our distance, washing our hands, wearing our mask. Again, that travel, testing before and after travel, if you happen to travel, can make a big difference so you don't accidentally bring in this new variant and spread it to others. And making sure that you're testing. We've seen a real decrease in the people getting tested. The beginning of any symptoms, it's really important to get tested right at the very beginning. And then it can be helpful to have surveillance testing. So if you work in a public setting on a regular basis and are interacting with the public, you should get tested once to twice a week on a regular basis to make sure that you aren't an asymptomatic spreader to others. So again, if you're working in the general public, consider getting tested on a surveillance basis on a once to twice a week basis to make sure that you aren't accidentally picking up the virus and spreading it to others. Continue to work with the process. Thank you so much, Alaska, for a tremendous partnership over this, what I would describe as a long and challenging week. We'll continue to figure this out together, and I'm excited to get so many people more vaccinated in a short period of time, and we'll continue to push forward. Thank you, and have a great weekend.